Let's get started. So, welcome everybody to Marvin Behavioral Health's Fireside Chat with Dr. Kerri Palamara. My name is Jacinta Harman, and I am the Director of Clinical Services here at Marvin. I want to first say thank you all for joining us today because we really want to take a moment to say happy early National Doctors Day. I think it's coming up on Sunday. We are very grateful for your dedication and compassion and tireless efforts in caring for others. And caring for all of you, I believe, is what drives us every day to do the best that we can for all of you. For those of you who might not know that much about Marvin Behavioral Health, we are committed to supporting healthcare professionals by providing resources and strategies that promote mental health well-being, both personally and professionally. We offer licensed therapy with psychiatrists, psychologists, and other fully licensed seasoned therapists. Our therapists specialize in supporting physicians in a completely confidential and protected way. We offer a 24/7 crisis line, and you can call us at any time during the day or night. We are here to help. There is a QR code in the back of the screen that you can see, and feel free to scan that and, take some time to come see us. Before we introduce our wonderful guest, I want to just share a little bit about her. Dr. Kerri Palamara leads the Center for Professional Wellbeing for the Department of Medicine at Massachusetts General Hospital. She co-leads their Workplace Wellbeing Collaborative and their Physician Leadership Program. She's a busy woman. Her academic work focuses, I believe, on physician coaching, clinician well-being, and faculty development. I know that you have won many prestigious teaching awards and that you have been awarded a mastership in the American College of Physicians. And with that, I would like to introduce Dr. Kerri Palamara McGrath. Welcome to our fireside chat.
Thank you for having me. I'm really excited to be here and to start this conversation with everyone.
We are hoping to, have a whole bunch of people, put questions in the chat. And as we get started, Um, I think that, the focus of the fireside chat was the idea of tapping into the resiliency that people already have, and kind of in this time of uncertainty, what it is that you are doing to help physicians with that and guidance that you could give people.
It is a challenging time to say the least. I mean, physician or healthcare in general was really hard several months ago. And it is even harder now because there are, depending on where you're practicing and where the people that you lead are practicing, your organization may be experiencing stressors that are related to corporatization of healthcare or just in general dealing with turnover and retention issues, a general sense of low value. It's very like us versus them mentality with C-suite leaders and other challenges. And then you factor in financial stressors and fear and uncertainty, and it becomes just very challenging when people are dealing within the walls of the hospital with uncertainty, when people are dealing outside of the walls of the hospital or the practice or clinic with uncertainty, when people are dealing with uncertainty in their professional lives and their personal lives and everything in between. It becomes a really challenging time. And to expect that people will be bringing the best of themselves to work every day and that best version of themselves will be able to make the best decisions and interact with colleagues in the best way. Like it just is really, it's a hard time to be all supporting each other and supporting our patients and supporting the system and the people we care about. It's a lot to ask of anybody. And I actually remember during COVID times, in the depth of COVID, a study came out that um, over 50% of physicians at any given time felt heightened levels of stress, anxiety, and uncontrolled emotional responses to stressors. And it was like, okay, stop for a second and think about what that quote means. That stat means that, like, if you walk down the hallway in your practice or walk down the hallway in the hospital, that half of the people you meet with aren't functioning
Mm.
emotionally or in a resilience way at their best. Like, that's hard. That's really hard to think about how to be supportive of others and yourself and still hold yourselves to high standards given that challenge. So much of this time and so much of what we learned during COVID that is super helpful now is like, how do we help people tap into their resilience? Helping people understand what resilience looks like for them, because physicians are resilient humans. Like, we don't have to make people more resilient. It's really about helping people connect with their resilience and think about what that means for them. And that's going to mean something very different for different people. And many people may not need like programs and services and extra things. They may actually just need things taken off of their plate. They may need a break from an obligation or responsibility. They just may need a little bit of support in a given time. But to give them space to find that language of what they need and how to be supportive is something that can be incredibly helpful right now in terms of resilience. And then when we think about managing uncertainty, the like single biggest thing I hear myself saying over and over again, and advice I'm giving to people and conversations I'm having with people is about how can we help people feel a sense of control right now? Because there is so much to be worried about. There's so much to be stressing out about, but we have very little control of most of those things. So if we spend all of our energy focusing on things outside of our control, it will be exhausting, it will be depleting, and it will be really unproductive, which will then be more exhausting and depleting. So if we help people think about like, yes, I'm going to acknowledge that things are happening that I don't feel great about. And I'm also going to choose to focus my energy in ways that I can control, in areas that I can control. Then you can at least feel productive and effective and build some momentum and energy off of that,
Mhm.
and likely have a greater impact on those other areas around you that perhaps you didn't feel like you had as much control over. So your circle of control may expand.
So then, if you were to think about, in your experience, hospital leadership, uh, you know, institutions where doctor positions work, work and where you spend most of your day, what do you think is I guess is the best kind of support system for them? Is it colleagues? Is it mentors? When it comes to tapping into just getting through the day.
I think it's all of the above. I think it is relationships and making sure that people feel seen and heard and valued. And the best route towards that is through relationship building. So as a senior physician leader, like you can't have a relationship with every single person. It's impossible. But you need your people to feel like they have a relationship with others. And so, like, one concept is sort of thinking about what is the relationship mapping of your organization. So, if you think about an individual level physician, like who are they connected to? And who are those people connected to? And how do you figure out how connected one individual may be to the tippy top of the hierarchy? And then how do you cultivate those connections so that people feel like they're part of something? So maybe that's mentorship. Maybe that is just a colleague or somebody so that people aren't feeling alone. Because often when we're stressed out or when we are overwhelmed, we retreat. We go into our little holes and we just like get our work done and get home. But how do we bring people out of those and connect them and build community with each other? Um, how do we use information sharing as a way to build community? Um, and so I think really proactively thinking, I may not be able to single-handedly care about every single individual, but I need to make sure individuals feel cared about. And so what are the systems by which like we can build that allow for that to happen?
Okay, I love that answer. So if we think about our day and how time is limited, and you know, emails get sent and communications are sent and we're doing it in a hurry and misunderstandings happen or emails take tones or you pass somebody
Mhm.
quickly in the hallway. What do you see as a way to improve communications with others, as you teach, as you do coaching with people? Is there a way or some suggested communication strategies that provide to people to avoid that?
I mean, I think yeah, there's a few things that I can think of. There's like your own part of it, your proactive, like what can I do to be a positive part of this? And then there's the receptive part of it as well. I think in general, there's this push and pull between wanting to get information out and wanting it to be perfect. And a lot of times we hold back if we don't know everything or don't have all the answers. But that can be misconstrued by people less connected to the upper levels of leadership that they're not saying anything. Nobody's talking to us. And most likely there are probably lots of conversations and a lot of desire to talk to people. So when you can't share actual concrete facts or outcomes, share your process. So it might be like, we're not sure yet what's going on with our NIH funding, or we're not sure yet what's going on with the people in our practice who are on visas, or whatever thing it may be, or we're not sure yet what's going on with the compensation plan. Here is what we do know. Here is our process to move forward. Here's when you can expect to hear from us again, so that people have a sense of the process, because then they can build trust. They can build trust in you. They can build trust that something's happening and they're not creating a version of the reality, because that's what our brains do when we're uncertain. We create the worst version and we start to control for that version. And so you as a leader could have a really eloquent plan, but if nobody knows about it, people will assume you have no plan or that you are actually against them when you could be so for people, but they don't know that. So I think not waiting till it's perfect, but also not rushing anything, because any rush communication will never be as good. So if it's rushed, at least show it to somebody else before it goes broad. And then if you can't share everything, share your process and share when they can expect to hear from you again. When you're on the receiving end, I think it's really important to remember that stat. If most of us aren't functioning in our best capacity emotionally, then to expect that every communication is going to be well done and in a perfect language or perfect tone is also unrealistic. So what I try to remember is, what is this person really trying to say? Let's separate the objective and the subjective. Like objectively, what is in this message? How can I assume the best of this person? Like if this is a really like not great email, I have to ask myself like what might be going on for them. And this is a lot of work, right? If you're listening to this and you're like, God, that's exhausting. Think about reading all those emails. Not every email you have to read like that, but the ones that give you an emotion, lean into that and think about like what is going on here? Is this about this person and it's that? Is it because they're the one that sent it to me? Or is it because of what was sent to me? Or how it was sent to me. Like really try to boil it down. Because if it's about the person, then disconnect yourself from the person and just think about the content. If it's about how it was sent or what was said, try to get as objective as possible with it. And then think about how you can share your experience of that. Like if it's process, say, in the future, it would be really helpful to hear about things like this, or something where you can give feedback about the process as opposed to the person or the content. So I try to use like my lens at like that coaching lens of like, how can I assume this person is doing the best that they can with the resources that they have and interpret it in that way, but then also sort of think about like which piece of this is actually really irking me. Is it
Yeah.
because it came from that person or it said that thing or it came that way? That can help me decide where to like really channel my frustration and then what I want to do with that.
Yeah. The relationship holds us hostage sometimes.
100%. And if there's no trust, then it's going to be really hard to build anything. And this idea of in the leadership course that I help to run, we talk a lot about trust being at the core of relationships and trust in relationships being at the core of how we can expect systems to change. There's a lot of this concept of well-being centered leadership, that systems can only change at the pace of relationships, and relationships can only evolve at the pace of trust. And so if you really focus on if there's a challenge, if there's something you need to work on, what is the trust? Like how much trust exists and how can you build trust? And if there are groups that are really opposed to each other, how can you actually align them in a conversation? If you are opposed to someone in a relationship, where is that alignment in that relationship? Where can you find some sameness among the difference? Um, and so focusing on how to start conversations from a place of trust, to cultivate that can really improve the relationship, which can improve the system.
Yeah. I think it has to be hard to, find trust if trust has been lost.
Mhm.
You talked a little bit about the idea of, the amygdala hijack, that one bad thing goes wrong and we react to it, right? And that's what takes over our whole day. That's what we give energy to when there is like 1,000 good things that happened during the day, prior to the event, prior to the email, or post the email. But for whatever reason, that one email or that one interaction with that person, we give all our energy to it and all of our focus. And sometimes we're unkind to ourselves and how we talk to ourselves, or how we respond. And so is there, and if this is too personal, obviously don't share, but is there a time when you truly felt overwhelmed? And how did you manage to keep going through that?
Yeah, I mean, there have definitely been times that I have felt overwhelmed, but I feel like, and I'm happy to go there next, but more connected to what you were just saying, that like sort of what you were just building, that sense of like you receive something and it really sticks with you, and your brain starts telling you all these like bad versions of the story, and that becomes your version and your truth. I think a really, I try to think of when I find myself in those places, or often when I'm coaching people in those places. Actually, just came up yesterday. Um, we were doing 360 evals as part of this coaching process, and somebody got something that talked about like, she holds herself like this, and she does it like this, and she doesn't do this, and that's creating this situation in the practice. And it was really hard for this person to hear, so much so that they wanted to be like, I don't even feel like this belongs in the 360. Like, is this really appropriate to put in the 360? And I was like, it's actually really appropriate for it to be here, because the purpose of this is for you to learn what it's like for someone to have you as their leader. And this is what that person's experience is. And you have a choice. You could reject it
Yeah,
and you could say it's their problem, not mine. Or you could choose to try to learn something from it. Like if we look at every piece of feedback, positive and negative, and everything in between, and look at it as an opportunity to learn something. Like what does this teach you? What could you learn from this? And we were able to like kind of take a step back and be like, okay, so I can learn that this person is not really appreciating this one piece of patient flow. And they see this as a real problem for the rest of the practice.
yeah,
So maybe one thing I could try is actually get several people together at the same role group and ask them how that patient flow is going and what ideas they might have. Rather than just looking at, I can't believe this person said this negative thing about me, turning it as like, how can I process this feedback? What's one thing I can learn from it? And then what do I want to do with that? And then you let that go. And that's the piece that is hard for people, is just to let it go.
yeah,
But I think the more you are positively, proactively processing it and like putting your energy toward doing something, like choosing to do something with it, that can be really energy giving as opposed to energy depleting. So that is my answer to the negative feedback one. Um, in terms of like a time where I've ever felt depleted or anything, I actually remember sitting down like a couple years ago, sitting down for a hair appointment. And I was, you see the same person every couple of months. And they were like, "How have you been?" And I heard myself. I heard myself like complaining, like way more than I like to be. I was complaining about work, and I was complaining about home, and I was complaining about how tired I was. And I was complaining about how I didn't have time for anything. And I was like, I looked at him and I was just like, I hate how I sound right now. I don't want to be this person. Like, I don't want to be tired and overwhelmed and overstressed and feeling like I have no time for anybody. Like, I care about people. I want to have time for people. And it was like this really big moment where I was just like, I'm
yeah,
not going to be this person anymore. And I just started to think about like, what would it look like to have time for myself? What would that do for my other relationships? All good things. What would it look like to have time for other people? What am I doing that's like a waste of my time? Like it's not giving anyone anything.
yeah,
What am I doing that like is a good use of other people's time, but perhaps not as much for mine? And I just started decluttering and thinking about like, how do I want to use my energy? Where's my energy best focused for myself and other people? And then what can I let go of? And it was so liberating, because I was like, it was all in service of wanting to be somebody I was like excited to sit in a chair and be. And but it took that like self-reflective moment of being like, listen to the story I'm telling about myself. And I didn't love my story.
Yeah. So what do you think led up to that? Because it didn't just happen in the
No.
spark of a moment, you know. It didn't just happen that minute when you sat in the chair and you heard yourself.
Yes.
So
No, I wasn't asking for enough help. I was trying to do everything myself. I was trying to be super mom, super doctor, super wife, super friend, super daughter, like super everything. And like super like employee, like all of the things. And I was just pushing the gas on everything and not asking for any help. Like there are some times where you have to push the gas on a couple of things and you're like you're pushing it a little bit.
yeah,
And I always say to people like it's okay to do that if it's about something you really care about. Like you have a grant that like this grant means everything to you. Like maybe you don't sleep a lot for like 2 or 3 nights while you're finalizing that. And then you give yourself time afterward to catch up. Like maybe you do that once a year about something that like really matters to you. Cause then it's like everything. You're like, I don't want to sleep right now. Like I want to be working. You can't live like that all the time. But if you're pushing it in every degree of your life all the time, it's unsustainable. And that's really what I was doing. And it required me to actually recalibrate how I was using my energy and like really recognizing like who was I really serving by this? I was actually the like aha moment. I like in addition to being in that chair, I like was like, what am I going to do about this? And I read this quote um that oftentimes there's a sense of restlessness that busy people get, where you're so busy being busy that you actually are robbing the people that are most important to you of your presence because you're like kind of diffusing your energy in too many places. And I was like, that's exactly what I'm doing right now. And so it really took that, but it was overcommitting and not asking for enough help.
yeah. In Ireland, we call that robbing Peter to pay Paul. So you are just
Absolutely.
taking away from something really important to maybe give to something that might not deserve it. And so relationships are one of the things that actually stand out in, you know, our company as to why people seek services because their relationships are failing or their relationships are struggling. So I think it must be really hard for doctors to just be all things to all people. And I think maybe when you train to, you know, and you take that oath to do no harm, is that what's instilled in you is to be all things to all people?
I think that I think, I often when I'm coaching people and there's like a weakness coming through,
Mhm.
I often say, at which time was this a strength? And it just got put on overdrive. Because usually our weaknesses are things that helped us at one point, but then we just didn't use them well enough. And like I think the Hippocratic Oath is similar. Like in the beginning, it was really elevating us to be like, you know, ethical and be there for people and support people. But I don't think in the Hippocratic Oath they were like, and also you're not one of those people. Like you don't matter. Like I don't think anyone meant that. But it gets portrayed and it gets like sort of celebrated that way. And I think people are walking that back now and saying, like, you can be an amazing doctor and have boundaries and have a life outside the hospital and have an identity that is not being a physician. You can be all of those things. And actually, that will probably make you better than if you weren't. And I think that message is coming through in some communities and in some spaces. And I hope that I we continue to see that coming through. But
Yeah,
also, when the Hippocratic Oath was written,
yeah,
you didn't have people like having multiple kids and working and taking care of the kids and driving carpool and managing their social media and volunteering as the PTA person and like whatever else people did. They like showed up and took care of patients and they went home.
yeah.
And so I think the world was just very different then. And we tried to hold ourselves to this same standard as the world changed, and we didn't.
Well, to me, what's interesting about this is that fact that doctors don't include themselves in that, like that it's pushed out there into the world,
Yeah.
you know, for everybody else. but not physicians as human beings who deserve the exact same standards.
Yeah.
That's,
There's a this expert in emotional fitness and positive psychology named Natalie Kogan, and she defines a leader as anyone who has the ability to positively impact someone's ability to thrive. And what she says is you can't expect to positively impact somebody's ability to thrive if you're not actually supporting your own.
yeah,
And that sticks with me all the time. Like if I'm not supporting myself to thrive, I'm going to come across as inauthentic. I'm going to come across as like disingenuous. And if I'm not taking care of myself, why should I expect anybody else to follow my lead? Why should I expect anyone else to take my advice?
yeah, it's true. I mean, what we permit, we promote, right?
Mm-hmm.
So I just wanted to let know people in the call know that they can type questions into the chat and we'll answer them if there's any things that are coming up that are, just like touching on people or just something that you'd really like some further clarification on. As Dr. Palamara and I are chatting, we'd love to take some questions from everyone. And just kind of like going along the lines of what we were just talking about, when you're dealing with the emotional toll of patient care, difficult circumstances, navigating family life, almost for some people being that sandwich generation where there's younger kids and there's aging parents, what is it that you coach people around how to take care of their mental health?
Well, I think it's important to note that anyone who is feeling like they have mental health support needs beyond the coaching conversation, that we normalize engaging in therapy and other potential resources if that's what people need. Um, and that is a sign of support, not a sign of weakness um, and a sign of strength. So I think it that coaching in many of these situations can be so complementary to counseling and therapy, and doesn't have to exist in a vacuum. Um, so I want to put that out there. But in terms of helping to process what we're experiencing, a lot of times I was actually working with a group of busy physicians recently who are like really, their days are insane and they deal with a lot in the course of their day. They hold a lot of angst and outcomes for in other people's experiences. And as I was talking with them, they mentioned that there's just no space. There's just no space for the, and so that day ends and they're exhausted and they go home and they're like drained and depleted and they want to have a good experience with their family, but they're just like done. And so in those situations, a lot of time the conversation is like, what, so you won't be able to like go away for the weekend and close the door and sleep and whatever else, but like what do you really need in that moment? And to honor the feeling that you have, actually honors all the important people that you were holding those feelings for. So whether that be like standing outside for 5 minutes and taking some deep breaths and like thinking, like really just letting yourself think about the patient, think about what happened, think about what you're grateful for, think about what went well, even if it wasn't the best outcome. Like really sort of processing that moment so that you can let it go. There's something called the going home checklist,
Hmm.
which I really appreciate, where you like think about something that happened that day, you process it, you think about what went well, you think about what could be different, and you let that you own it and then you let it go. And I think that's a great practice to be in, whether that be a walk home, a commute home. Um, but on as you transition from one environment to another, allowing yourself, like whether instead of going on social media or reading the news, just taking that moment to like honor that experience, honor the relationships, and just allow yourself to process it. Or maybe you thinking is not what will feel good in that moment, and you just need an outlet, whether it be music or meditation or something. None of this takes very long, but it can be really it can really help restore some of the depleted feeling that pe many people get in the course of these like busy days or
Yeah.
even like busy weeks where you're just so behind on life and taking care of yourself and everything else. Like, how can you find the small moments to restore a bit throughout the day and build yourself up? There's also this concept called positivity boosters,
Hmm.
where like, what is your positivity booster that you can lean on at any time? It'll just give you a little boost. Those I think are really helpful to connect with.
Yeah. I'm a licensed therapist, and it took me a really long time to do this. But at the end of every day, I sit down and I can't meditate. I wish I could. So, my brain just goes to 1,000 different places. But what I do is I make a checklist of, what went right today. And I start at the very beginning of the day. I woke up, I get a chance to do this again. Instead of saying I have to, I have to, I have to, I change it to I get to. I get to have breakfast with my family. I don't have to feed my family. And so I found that or doing the ABC, the alphabet of gratitude is just what resets my brain.
Yeah.
Just ABC, I'm grateful for A, B, M, always Marvin, of course, but um, and myself. But, you know, in thinking about the things we were just talking about, we have a crisis line here at Marvin and it's available 24/7. And people seem to call it after 11 o'clock at night.
Mm,
People who are calling are usually people who are having a moment. So they need some emotional resiliency because they are overthinking, they can't sleep, something happened at work, and they just need a moment to debrief. And I think having that moment to debrief, it mitigates the negative impact of what it is they're thinking about. But I wish there was something that they could take home with them on the drive, as you were talking about, or when they wake up, or as they sit there ruminating. I wish there was some skill that we could just tell people today to how to just reset their brain in that moment.
yeah. I mean, a coaching skill that is often used is so many times we feel overwhelmed by the feeling
Mm.
without really allowing ourselves to think about what's behind the feeling. And so if you explore the need that's behind the feeling, because all feelings, it's basically from the concept of nonviolent communication,
Yeah.
and that experiences give us feelings. Feelings represent needs that are either being met, good feeling, or unmet, bad feeling. Um, and and so if we actually take a moment to think about the need, we can consider how could we meet that need. So if you're feeling scared, if you're feeling sad, if you're feeling frustrated, whatever it is, actually taking a moment saying, like naming it for yourself and saying like, why do I think I'm feeling like this? Well, I'm feeling like this because I didn't want this patient to have this outcome, or I didn't want that conversation to go that way. And I didn't want it to go that way because I actually really need this person to be aligned with me right now. I don't need to be in conflict with them. So what I really need is resolution. I'm not sure that resolution is going to come from that other person at 11 o'clock at night, and honestly probably shouldn't. So is there a way I can focus on resolution internally? And you go from feeling like lost in this feeling of conflict and feeling sad or frustrated to like, what resolution can I give myself right now? Maybe I'm just going to resolve to say, in the light of day tomorrow, with a cooler head, I'm going to reach out to this person and start to think about how we can rebuild trust or something. But it allows you to walk through from a feeling that just feels terrible to like, what do I actually want to do about this feeling?
Yeah. So this would be one of the ways that coaching and therapy aligns because if we
Yes.
engage in a negative behavior, we're doing it because it's feeding something.
Mm,
Would you agree with that concept?
yeah, yeah,
Yeah. And so what you're saying is that we need to, instead of just mowing the grass to get rid of the weeds, we need to dig down deep
yes.
and dig out the root of the weed.
Yes, yes. And I think like these times of uncertainty are very similar actually, where people find themselves like ruminating and stirring and trying to figure out like as your brain's creating this like unhelpful story of whatever certainty it can come up with, it's like then really thinking about, what are you going to do with this? And it's like, what do I need right now? Like, where can I find certainty? Where can I find control? And how can I focus my energy on that? I think it's that same idea of like, rather than being caught in a negative loop, what can you do? How can you use that same energy that is giving you nothing? It's only taking. How can you use that same energy to actually serve you as opposed to work against you?
Mm. That is powerful, thought process right there. What do you think is the barrier for people as to why they, don't ask for help or, maybe somebody goes to a workshop and they hear something and they don't even know that something's wrong. So where do you think that thinking comes from?
I think you have to have some degree of self-awareness or desire for self-reflection. So if you're just like therapy, if you're not open to these concepts, then you can't force them on somebody. But assuming that people might be open to considering it, it's really thinking about personalizing the concepts, like what would this look like for them, and also normalizing asking for help. Um, and in a way that tries to get over that shame barrier.
Yeah.
Like if I ask for help, it means something's wrong with me. If I ask for help, it means that I'm weak. It means that somebody will think I'm incapable, which is so fascinating because most of the time, like think about any time someone has asked you for help. How does that make you feel?
Yeah.
Right? You feel so good. You feel so important. You feel so useful. Like, why wouldn't we allow other people that feeling? And often, like, when I'm talking with like a patient or a colleague that's had something really bad happen in their life, and maybe they need a break or time off or something, or maybe like a new medical diagnosis that they personally are experiencing, I always say to them, people want to help. Just think of things that you can tell people, like out whatever you can outsource. Just give people things. Otherwise, they're going to do all sorts of unhelpful things. But people love to help. And so, but for some reason, we've told ourselves this story that asking for it means there's something wrong with us, and we're burdening people.
Hmm.
And if we can let that go and recognize that we are helping people if we ask them for help, I mean, obviously, overdoing anything is too much, right? But in general, if we ask for help, people typically see that as like a sign of value, that how you value them
Yeah.
and how you value their importance in your life.
Yeah, they're trusting you.
Yes, it builds trust. Yes.
They're trusting you with something that they need help with. And so that's going
It's
to,
authentic.
that's exactly, I was searching for a word and it's validating and it's authentic. And it would be a great thing to allow yourself to be vulnerable like that.
Yes. And to normalize that like I may know a lot of things, but I may not know what I need right now. Or I may not know how to help myself right now all by myself. I may need more.
Yeah.
So creating a space where we're not the expert of everything all the time and that we're open to support, um, really breaks down, I think, an important barrier that we have.
I talked to a physician recently about Marvin services and he called me just because he was struggling with some stuff. And I was like, why have you not signed up? And he goes, well, I want to save it for my residents. I want to save it for the other people. Like, so while you're busy saving everybody else, who's saving you?
Yeah.
And he just did not want to take away one clinician hour to the other people in his system. And I found
Yeah.
that, I just found that fascinating.
I see a lot of times like the person who either like doesn't want to be the person who needs to take medication or doesn't want to be the person who needs therapy. They don't want to like have to change themselves because of something. And I often will say to them like, what is happening in your life has already changed you.
Isn't that true?
So if something, if you could engage with something that would help you get to a place that feels better, like why wouldn't you want to do that? What is the harm in doing that?
Why not set that standard for yourself? You deserve that
Yeah,
standard.
yeah,
You
yeah,
you would want that standard for anybody that you love, anybody
right.
that you care about. If we could set that standard, how we talk to ourselves, how we talk to the children that we love, the people that we love, we would never talk to them the way that we talk to ourselves.
I love that.
So why don't we set that standard for ourselves?
Right. And start to change that narrative.
Yeah. So I have two questions left. I don't see any questions in the chat, but
Oh, it looks like one person just put one in.
oh, okay. I'm not seeing it, so maybe you're seeing.
Oh, it says if you could make one change to the medical field to support resilience, what would that look like? Oh, that is so I can tell you what like if I could wish one thing for my own organization, because I feel like thinking about like the medical field, like the entire field is perhaps a bit daunting. Um I mean, I guess if you just took payment completely out of things,
Yeah.
maybe that's what if I would change for everything, right? If just everything were you just gave people what they needed and when they needed it, and we didn't have to worry about like payment and reimbursement, then there wouldn't be hamster wheels and packages and other things. If like the world just existed without money, that's probably what I would wish. And so obviously that is not sustainable or realistic. But one thing that I think would have a really big impact on resilience is if these principles were infused into leaders from the top all the way down. If we took a human-centered approach to leadership in healthcare, where we incorporated these principles into every conversation, every decision, every meeting, and how we evaluated opportunities and experiences and protocols and regulations. Um, I think that that would go a really long way in changing the humans' experience of the healthcare system. And by humans, I mean the people taking care of the patients, the people interacting within the system, as well as the patient experience. So if I could just go around the world teaching healthcare leaders about well-being and well-being centered leadership, that would make my heart sing because I feel like it would have such an impact.
Yeah. In thinking about that, you're saying from the top down, which sometimes can feel like turning the Titanic, right? What do you think about the idea of having medical schools or training programs start there as well and kind of promote this kind of thinking and self-care and resilience and healing and avoiding pressure in times of crisis?
I think that is really important, provided it is done in an authentic way. And what I mean by that is if you're teaching that to people, but then sort of figuring that they're just going to do that on their own time and also pushing curriculum and doing and like not changing the system in which they are functioning, I think you're setting people up to fail because then it's almost like you're so exhausted trying to be resilient and trying to be well and trying to live up to people's standards. So that's why I think it actually has to come from the leadership. And yes, those rising students will eventually be the leaders. And I appreciate that like dynamic system. But I think if we're teaching those principles while also thinking about changing the system in which they are learning them, that's really where the meaningful change can happen.
Right. Well, in the essence of time, I am going to ask you if there's any, last little nugget of advice that you would give to people and, just something they can take with them through the weekend that would just let them give themselves a break, maybe.
I would, so I'm going to think about one thing that you could do for yourself and one thing that you could do perhaps for other people in the world around, like in your practice around you, which you can feel free to do one or both. Don't feel like you have to do everything if that's not where you are. Um, I think for yourselves, one, so in that moment when in the hairdresser chair where I
Hmm.
decided to make that change, I realized I was giving 120%. and that I was overgiving and I was losing on the back end of that. And so I started to really push myself to give 100%. And I was like, okay, here we go. This is the part where people start complaining that I'm like not doing enough. People start noticing. And what's crazy is that not only did people not complain, they were like, wow, Kerri, like I just feel like you have such great ideas and you're always so available. Like, how do you do this? And it's so great to be able to work with you. You always are so quick to respond. And all people talked about was what a good job I was doing.
Yes.
And all I could think of was I was doing less. And I was like, holy smokes. And that really taught me two things. One was that by doing more, I was doing less and that like I was actually cheapening the everyone's experience of me. And but by doing less in terms of overcommitting myself, I was able to really double down on my presence and the experience of working with me in those moments. Um, so I would, if you identify as someone who is giving over 100%, which I would be willing to bet most of you do, pilot giving 100%. And just see what happens. See who notices and who doesn't. See what they notice. See how it feels. See what more you get out of that. Um, Ask yourself if that email can wait. Ask yourself if you cannot check your email for a few hours or a day on a weekend when no one should really be expecting you to anyway. When you wake up, don't go right to your email to make sure nothing came in overnight that you need to address right away. Just wake up. And just start there. Start small. If you're not sure where to start and you're like, oh, it'll take me a little while to get rid of that role, like just start small with small changes to protect your time. We fear boundaries sometimes because boundaries have this like ugly connotation. Like if I'm setting a boundary at work, it's like I'm overvaluing myself and like I'm too important or whatever story we tell ourselves. But actually, the cool thing about boundaries, it's a way that you can respect the energy that you're giving to other people. That's what a boundary is. It's honoring the relationship and what you're willing to give of yourself to other people. So boundaries support you in supporting other people. So think about your boundaries. Examine your boundaries. When does it feel like maybe you could use some more boundary work? So just witness your time and how you're spending it. And then for other people, do that for other people. Say to them, I didn't need to hear back from you right away. You didn't have to apologize for not getting back to me right away on that email. Or, it seems like you are really pushing it lately. Is this how you want to be doing it? Or does this feel like what you're supposed to be doing? Allow people to to see what you're noticing and share that with people. And also just try to think about, like we were talking earlier, ending your day with the positives. Share that with other people in an elevator. Say one good thing that happened that day and see what people's responses are. They're often like, whoa, what? Practice in conversation with other people, asking for a good story or a good experience or what they're grateful for. Give people compliments. Tell them how much you appreciate them
Yeah.
and see what the dynamic is. Most people are like kind of overwhelmed by it. But notice how it builds relationships and builds trust when you do that.
Yeah, it just makes somebody's day when you say, "Hey, I love your jacket," or "Great hairstyle," or "I love the color of your hair." Or, it's just like the most simple thing that you can do, but you're just going around kind of spreading positivity, and in that moment, it makes that person smile, and it's such a tiny gesture, but
Yeah.
it means the world to somebody who could be. We have no idea what people are struggling with. We have no idea what is going on in their world. And if we can be that person, I think, as you were saying, who gives them a momentary pause to be like, think something positive, that is a
Yeah.
gift. That is,
Absolutely. Or like in your office, if somebody like does something that's not their job, be like, I really appreciate you going out of your way to do that. It made a difference for my patient. And just reminding people that they matter, that they make a difference.
yeah, because we take for granted that they know, right?
Yes, 100%.
We absolutely take for granted. And it that builds trust, back to the trust in the relationships, that people
Absolutely.
aren't just going to hear from you when something's going wrong. It's going to be a more balanced relationship. You'll get the good with the bad, or the constructive. And so I like these parting words of advice. Thank you so much.
Oh, my pleasure. It's always so fun talking with you. I feel like we could talk for another 2 hours here.
Well, I'm sure there's people on this call that maybe have homes to go to. So I do
Yeah,
want to thank you for taking the time to be with us today and for everybody who joined. And pe folks can find you, very easily. We'll be sending out this video to people who joined, and I know that you would welcome any kind of outreach from them. So thank you a thousand
absolutely.
times. And kudos to your hairstylist. Your hair looks great.
Oh, why, thank you. My thank you. We've been together a long time.
All right, take care, and we'll talk to you soon.
Bye, everyone.